How is it that a problem which impacts millions of people in every country in the world gets so little attention? The current community mental health system is not working for people with serious mental illness. When city government officials talk about homelessness and incarceration and the overuse of emergency rooms and hospital beds, they are sure to point at people with serious mental illness. But then, when they design these programs and these services, they develop the wrong kinds of programs and target the wrong people. A large part of our community mental health system does not focus on the people with the most serious mental health issues. And yet, this is the group that actually costs these same governments millions of dollars. But it's really not just about the money. It's about this group of people. This is not a group of people who are throwaway people. People who can be discarded because society decides that they don't understand these issues. And actually, probably that they don't want to understand these issues. And it's not just the governments that are the problem. It's also the mental health professionals who are lacking in a solution to this problem, and therefore, because they don't have a solution, they're diverting resources to other issues and other populations that they think are easier to solve. My argument is that you have to do this differently. You have to focus on people with serious mental illness first, and if you solve that problem, then you can work on others. In my 40 plus years in the field of community mental health, I have seen many misguided attempts to address this problem of serious mental illness. In the 1980s, I worked under the Dukakis administration in Massachusetts, which put together an initiative to close the state hospital beds, and I had a little bit of a role in it. But the interesting part about it is that they failed to develop an adequate set of programs to deal with the same people who they were asking to leave these hospitals and live in the community. And then I came to New York, and within a couple of years of being here, Governor Mario Cuomo signed a bill in our dining room right here in Fountain House that was about the closing of state hospital beds in the early 1990s. But he and the state legislature only allowed 1/3 of the money from the savings to go into the community support program. So once again, it was not very well funded, it was not very good programming, and so again, the problems came up that people would see in homelessness and incarceration. And this trend of closing state hospital beds also had this other effect, which was that the money that formerly was being provided by the state funds, was shifted into Medicaid and Medicare dollars, which are federal dollars. But the problem with those dollars is that they are not very good funds for places like Fountain House, because the nature of those funds is they are medical funds, and the nature of the services that we provide are broader than that and more and different. And so I think of Fountain House as being the cornerstone of the solution, and I think that we have to figure out a different way to get the money into these systems. When people ask me why there are more, there's a common question that people ask me all the time when they come to visit Fountain House is, why aren't there more places like Fountain House in the world and in the country? And for many years, I really kind of struggled with what's the right answer to that question. And I've really come up with two really strong thoughts about this. One I get from my friend, Dr. Ralph Aquila, who often says, people have to believe. And what he means by that is, you have to have a belief in the recovery, that recovery is possible. And unfortunately, many mental health professionals don't actually believe that. They really don't generally believe that our people are going to do as well as we believe that our people are going to do. There's a very long-term, outstanding myth about people who have bipolar and schizophrenia and their abilities to do things that goes back a long way and is just wrong. And we've proven it wrong time and time again, and yet it still persists as a myth. But the second, and maybe more important issue, is that there isn't adequate funding for places like Fountain House in New York or around the world. And to me, I've come to understand clearly that that is the biggest issue, that if there is adequate funding, when people try to compare models of programs that are developed based on Fountain House, they're often comparing them to things that cost 5 or 10 times more than those programs do, and they try to compare them as though they're equal, and it's really an unfair kind of comparison. The other problem with the funding is that if people continue to try to make Medicaid and Medicare work for programs like Fountain House, it's really a problem because you're trying to bend the funding stream to match the programming. And really what I believe is that the programming should drive the funding streams, and that's really been the problem. It's always been the opposite, you know. In our current environment, many of the services that we offer are now referred to are social interventions. That's the way Fountain House might talk about them. More broadly, in the public health arena, they refer to them as social determinants. But historically, and this has been in my history, in my work, many mental health professionals and governments thought of social determinants as kind of ancillary services. But guess what? It turns out that we are actually a primary service, and we are actually the glue that should hold the support system together. And I think that people are beginning to come around to our way of thinking, and I think it's important for us to continue to push that message. Fountain House and places like it need to be the center of the system, not on the edge. Real change is going to happen when there are 20 multi-million-dollar Fountain House places in New York City. The same would be true in cities around the country and the world. If we built enough of these centers in a city, it will go a long way to solve the problem of homelessness and incarceration. But it's important. In New York, they tried to do this a number of years ago, but then they underfunded the programs, and they didn't continue to increase the funding for those programs, and they just are not adequate. So if you're really going to take this seriously, and if you're really the mayor of a city, then you really have to fund these at a good enough level. And you know, I think if you're trying to solve the problems of homelessness and incarceration, this is a solution to that problem if you just figure out a way to reconfigure the money. And often the arguments that we hear when we go to talk to places is, well, we don't have the funding for that particular operation, or the money we have says you have to do it this way. I'm doing some work right now in Arizona, and most of their funding is Medicaid and Medicare, and it's very difficult to build a good, solid program with that kind of money because it restricts what you can do, especially around the kind of work that we try to do within Fountain House. So anyhow, this leads me to the need for our leadership and why I think we are the best people to lead the way, and the best way to create really good quality community mental health programs around the country and around the world. The medical world is coming to understand that certain problems, the solution to certain problems is social determinants, and that social determinants are crucial for people to recover. And Fountain House and the many places around the world like us have been perfecting our social interventions for people with serious mental illness for over 70 years. So we've been really looking at this and studying this and thinking about this all the time, long before anybody else was thinking about it. So that's why I think it's important for people to listen to us, because we actually know what we're talking about. We actually know this better than most people in the world. We have an appreciation for the need for a place. And I believe very strongly in this concept. I think that the field of community mental health has gone off track when they don't focus on building these places, and I've come to start referring to them as community centers, just as a way of communicating information to people in a way that they might begin to understand. In our work we tend to use a lot of inside language, and we really have to learn how to be broader and be able to communicate with the larger world in a different way. But I do believe that you have to create these community centers like Fountain House. They have to provide a base for people to make their forays into employment and education and housing and build social networks. So one of our original tenets at Fountain House is that we should build a place to come and a place to return to. And it has always been one of the things that I pay the most attention to, because I believe very strongly that this particular concept of place has gotten lost in the field of community mental health and needs to come back again. And that a place is not a housing place, because housing is a different thing. Housing is a home. You shouldn't be building services into your home. My friend Paul Carling, who's one of the original people who reversed the thinking about housing, really felt strongly about this as well. And so the place I'm talking about is more of a community center, so that people have a place to go during the day. So we need to inspire these places, we, the Fountain House community, so that they can support the idea that people with mental illness can have a good life with jobs and schools and homes and friends. When we were writing the book on Fountain House, we wanted to call it The Need to Be Needed. That was the title that I wanted anyhow. Because to me that concept is the core of our practice. I believe that all people need a purpose in life, a reason to get out of bed in the morning. Fountain House and our friends understand that providing people with the assistance and the help is sometimes necessary to get people started, but the real therapeutic benefit of our community begins when a person contributes to that community, like all of the people in this room, for example. When a person gives to their community, that's what enhances their self-esteem and their recovery. That's the beginning of their road back. My next thought on leadership has to come from another great leader of Fountain House, Jeff Aaron. He taught me that we needed to think big and to understand that we have something very special to teach the world, and that is leadership. As a group, all of us are impacted by the stigma of the illness. But like individual members, we must be more outspoken about what we know is needed. In order to do this, though, we need to constantly improve our communications to the world and explain what we know to be true. We have a great deal to teach the world. We have to engage allies, and we have to convince others of the importance of our mission. More than anything, the strength of Fountain House is our moral standing and the gravitas on the issue of human rights of people with serious mental illness. There is no place in the world that doesn't see Fountain House at the center of that particular concept. That this is the place that everybody knows cares the most about people with serious mental illness, and the one that has consistently done so for over 70 years. So when I talk about these voices, though, I mean both members and staff of Fountain House. And that I believe very strongly that our partnership voice is stronger than any professional voice alone or any peer voice alone. Our roots are WANA. And it's not an accident that it's Wana, because it's we are not alone. And it's in that we that we draw our strength. Under Jeff's leadership, Fountain House pursued the Hilton Humanitarian Prize for almost 20 years, not for the money or the award, but for the recognition of our issue, our people, and our work. Fountain House was developed by a couple of ex-patients and social workers, but it is soared under a group of community organizers. We are now poised to take the next great leap and let the world know that we have a better way to address this issue. Who will constitute these new leaders? I would suggest it is some of you who will listen to this piece, and I challenge you to rise to the occasion. When I was 25, I knew that this was a great answer to a problem, but it took me years to develop the confidence that I could speak and be a leader in this work. You can too. We took the prize and we used it to enhance our relationship with the World Health Organization and to convince our sister centers all over the world to embrace the prize and use it to soar, or in our house, to roar. We are at a great moment in our work. We can change the direction for millions of people if we can just show them and the governments of the world the wisdom of what we know. For many years now, I have accepted the burden that it is our failing if people don't understand the need for places like Fountain House, and I pass on this burden to all of you. We must become better at communicating our methods and practices to improve all those lives. The biggest disappointment to me in the last decade was to learn how large the number of people are who are in jails and prisons. I look at my friend Tom and others at Fountain House, and I know that we can change this trend if we just develop more places like Fountain House. I have my opinion about why the community mental health system has failed all these people, but I think it's more productive to focus on the future and the solutions. I have known since 1978, when I first visited Fountain House, that this was the answer to a human crisis, and a way to bring dignity and justice to a group of people who I now consider my friends. We must continue to strive and to inspire people to use our secret sauce or experience a little of what I call the Fountain House magic, and eventually we will succeed. Questions?
I'll start. You and Fountain House created this webinar series to tell about the history and heritage of Fountain House. And I want to know, why is it so vitally important to report this history?
It's because I believe that we have got to become better. Fountain House is a leader and will continue to be a leader, and we need to figure out very clear ways to communicate with people in different places. We have to be able to communicate with mental health professionals, with families, with people who have the illness itself. And so it's a constant piece, and this technology and this way of working is an ideal means of communication. And as I said before, we can safely speak with a great deal of confidence that we are people who can speak on behalf of this group, both members and staff of Fountain House. I think we're all in this together, and we want the rest of the world to join us, basically.
Do you believe clubhouses can work in serving the needs of people who live in an area where there is a large population? And what are some ways to make inroads into those cities and regions?
Yeah, I appreciate the question, because I've over the years I've kind of changed my thinking about this a little bit, and I believe that it's probably in Fountain House's best interest to focus on cities initially. Maybe eventually more. And I know there are clubhouses in rural areas as we speak, but I think in order for us to really make the world see what we have to offer is worthwhile, is we have to focus on the cities. You know, when I think of Helsinki, and I really applaud their effort, Helsinki, Finland, for those you don't know, to develop multiple clubhouses within one city, because I really think that that is the way that this is going to be able to be successful. We have to, and I do think that maybe they have to be run by the same group to make them stronger. But I feel as though the programs have been underfunded for so long that they have to be big enough to impact on the problems that the city is looking at, and then it will have a kind of a snowball effect where people will see it and they will want more of them, and then we'll get it. I mean, when I said 20 places in New York City, I'd had a debate in my own head where I said 30 originally, and then I thought, well, that's a little too much, and then I said 20, and because I ultimately think if they were as big as Fountain House, we would need even maybe 10 or something, but realistically they'll be smaller, and therefore I think you need like that many. But that's what it's going to take to really impact it. And these community centers, these clubhouses, these Fountain House programs, they can be the center of the operation to support this group of people and solve the problems that the cities want to solve, which is homelessness and incarceration and overuse of hospitals, and but they've got to be done at a big enough scale. As I said earlier, I think the problem that we've often found ourselves in is a lot of places get funded with just a little bit amount of money, and they have 3 staff, and they're supposed to be competitive with these places that have 150 staff, and it just, you know, we have to just talk about that openly and say, well, look, if you're going to do a fair comparison, well, then you got to take a place like Fountain House and compare it to something like that. You can't take a 3-person place in a church basement and say, well, how come that doesn't work right? Well, you know, you need to fund these things to a bigger extent.
So you mentioned during your presentation how critical it is for these clubhouses and programs to have adequate funding. What would you suggest is a critical first step in achieving this funding, or perhaps a best practice?
In the United States, I've thought about this. In the United States, I think that the state governments have to step up again. I think that the state governments walked away from this particular group when they started using Medicaid and Medicare. And the interesting thing is, I think that ended up costing them more, because Medicaid and Medicare are entitlements, which means that you can't block the front door, for lack of a better way of putting it. I think that, you know, in the 1950s and 60s, the states were the primary funder of mental health services in most states in this country, in the form of state hospitals, of course, which probably wasn't the best structure. But I think that the states have to come back at this, and I actually think if they did it, they would end up saving more money, both at the state level and also from the Medicare and Medicare system. I think that, but the best funding that I have seen has been where the state itself contracts with programs directly, and that seems to be, that gives the greatest flexibility. We believe strongly in Fountain House and outcomes. You can measure outcomes. The problem is a lot of state people want to measure the process because the outcomes aren't so great. I say, give us the outcomes, we'll give you the outcomes, we'll give you employment, we'll give you education, you know, we'll give you stability on people, we'll keep people out of hospitals. We can do all that, but you've got to put this money in, and it's almost like a block grant. The problem with some block grants is they tend to cap them, and that's a problem, but that is the best form of funding for places like Fountain House, I believe.
I had a question. Why do you think politicians and mental health bureaucracies find it so difficult to understand our needs and the process that we
Well, you know, I blame some of this on the mental health professions, if you will, or the medical professions, because we have been pushed over to appear to be ancillary services, you know. But I think the world and the medical world is coming around to appreciate that for certain issues, that the kinds of work that we do is crucial. And, you know, and I would argue it should be, as you heard, the center of the operation. But even if it's even in partnership, and it should at least be even and funded accordingly. And I think that that is why sometimes when governments go to start to develop, when I was in Massachusetts, and they were starting to do this program to develop services for this population that was coming out of the state hospital, I watched the kind of the mental health politics of the whole thing. You know, those who were arguing for day treatment programs and those who are arguing for housing and case management. And so some of it has to do with just that. And yet those were not great solutions. You know, case management is a fine program, but it really is a limited service in terms, people can't do what they need to do. You have to build programming. You have to build ways to help people go to jobs and school. And if you don't do that, then it doesn't work. So I think more and more people are coming to understand that the best way to help people is by building places like Fountain House, because all those people who ended up in jail, the reason they ended up in jail, well, some of them are criminals, okay, but a lot of people ended up in jail just because they couldn't get through the world out there, and they would bump into people in a way that that shouldn't have happened. And I think it's, if you have people who are supporting you in those situations, it doesn't happen quite as often, it doesn't happen as much. I think we could make a much bigger dent in that problem, and I think if city governments come to understand this, I think it'll make a big difference.
Any other questions?
Good, great, thank you very much.
Great.